Mondays, Wednesdays, and Fridays on Eagle Eye News at 7 and around the world by a miracle of television, if you will. Red Mange is what we're going to be talking about this week, and just thinking about it, I start to get all itchy. I think of a dog in the back of the radio station just rolling around in the dirt. Red Mange. Good morning, Dr. Joel Saylor.
Good morning, yeah. Red Mange. I always think of Red Grange, who was a very famous football player way back in the Galloping Ghost, yeah.
No, number 77.
Yeah, he originally played for Illinois, didn't he?
Oh, see, now
and then Chicago. Yeah.
Oh, you're going to get serious. I don't want to chit-chat.
Well, only reason I know this is my dad is originally from Illinois.
Well, my dad loved Red Mange, right?
Red Mange.
Red Grange, number 77. I didn't know about Illinois. Yeah. That's pretty good.
Yeah. So anyway, we're not talking about Red Grange. We're talking. We did briefly, but now we're going to talk about Red Mange.
Okay.
And what Red Mange is, and that is a layman's term for demodectic mange, okay? Or the actual medical term is demodicosis, which is the condition of having demodex mites. Okay, so red mange is caused by a mite. A mite is microscopic, okay? And so these little mites live down in the follicles. Now, it's not communicable. So if one dog gets red mange, another dog is not going to catch it casually. Okay. Now, a lot of people think it's communicable because several puppies in a litter will have it. And the reason several puppies in a litter have it is hereditary. Okay? So it's what we call vertical transmission, not horizontal. Horizontal will be a communicable disease. Vertical means it runs through the genes. Okay? Now, a lot of species have these similar kind of demodectic mites. We have them that live in our eyelids, and at night they come out and munch stuff up, but they don't cause a problem. There's a defect with these dogs that have red mange that allows them to manifest and proliferate and cause skin issues. Okay, and so what you get is a dog that has a lot of hair loss, a lot of scabbing. Okay, and then a lot of times they'll get infections and they just feel miserable. And it is a systemic disease, even though it's topical. There's systemic manifestations. Okay, now it is treatable. It's easily treatable. Okay, and burnt motor oil is not part of the treatment. So if you've got your little burnt motor oil, or if the old guy down the street came and said, oh, you just put burnt motor oil in, please don't do that, okay? And I say that as a shout out to Roger, and Roger, I know you listen, so this is your pet tips for this week, okay?
Once upon a time, that was the way to go. Not that it worked, but
well, that's what was done. That doesn't mean it was ever actually sanctioned by anyone who actually studied veterinary medicine.
Well, no, that's true. Well, how about dog dipping? They don't do that anymore.
Well, actually, Mitaban still exists for Demodex, and actually, Mitaban is still the only approved FDA treatment for Demodex.
Okay.
However, back in the early 90s, original research was done looking at the use of ivermectin, okay, for the treatment of Demodex. And ivermectin, when used at an appropriate dose, can very effectively take care of Demodex, and it is a lot easier to do because you don't have to do any dipping. It's just medication, and within usually 2 to 3 months, they're completely cleared up. Okay, and they do well with it. So that's usually the way to go. So if you have a dog that has Demodex, one, it is treatable, so don't let anybody tell you it's not. 2, don't use burnt motor oil. 3, go to your veterinarian and let them diagnose it, because one of the other things that looks like Demodex is sarcoptic mange, and that is communicable. Okay, so you want to make sure you got that, and that one is communicable to people, so you want to make sure they got that covered. And then again, get the appropriate dose and get it treated. Okay.
You had said something too. It takes about 2 to 3 months, so you have to be diligent in the care.
You got to be right on it, and again, expect a couple of follow-ups with your veterinarian. It's not one of those one and done, flip the switch, hey, we're all fixed. The other thing I will emphasize: if you have a dog that has Demodex, whether they're male or female, okay, we encourage and strongly encourage that animal be fixed, okay, either spayed or neutered, because again, remember what I said, it's hereditary. A high, and I mean high, percentage of the offspring of those matings will have Demodex.
All right, and we'll be back right after this.